Good? Okay. All right, before we start, my name's Jill Garrett. I'm the nurse practitioner of the Secondary Stroke and TIA Prevention Clinic. It's an outpatient clinic where I see patients who've already had a stroke or who've had TIAs, and they come to me for risk factor modification. But before we start, I'm going to have everybody give me a big smile. Okay, now everybody put both arms out in front of them. Okay, and now you can put your arms down, and I'll say, today is a sunny day. Well, good. That is FAST, F-A-S-T, which we're going to be talking about. It's a fast way to be able to recognize the signs of a stroke. So, around 800,000 people in the U.S. have a stroke every year, and that turns out that it's about one stroke every 4 minutes. Stroke, I need to update my slide. We're fortunate is now the 5th leading cause of death. However, it is the leading cause of disability. And some strokes have major impacts. Others you might look at somebody and not know they've had a stroke, but they can lose vision, part of their vision. That means they can't drive, they can't get to school. My son had a stroke when he was 19, couldn't drive for a while. They can't get to the doctors, can't get to the grocery store, can't go to work. Some people lose speech. I had a young girl in the clinic who lost her speech, and unfortunately her job was on the telephone. So you have to kind of reinvent yourself. 1 in 4 people will have another stroke, usually within the first 5 years. And obviously recurrent strokes have an increased risk of death because you've already had some damage. You heard about what strokes are, interruption of blood to the brain from the video, so we can skip that. Depending where the stroke is in your brain, you'll have different symptoms. If your stroke is in the back of the brain, that tends to affect vision and balance. Right-handed people, the speech centers on the left. 95% of people with speech centers on the left. If your stroke's on the left, you lose your speech. The opposite side of the brain controls the opposite side of the body. Who's clicking for me? Am I clicking? Oh. TIA stands for transient ischemic attack. Some people call them mini strokes. They have exactly the same symptoms as a stroke, but you're not left with any residual deficits as you are with a stroke. The symptoms generally go away within several minutes, an hour, always gone within 24 hours. People think that that's really cool, that they got better from the stroke. It's actually very concerning because it's a red flag for stroke. Knowing your risk factors, in your handout or at the back of the room we have little risk factor sheets that can help you assess what your risk of stroke is. And I know it sounds it's doom and gloom, but the good news is 80% of strokes are preventable by knowing what your risk factors are and trying to reduce those risk factors. High blood pressure is the #1 reason for ischemic strokes and hemorrhagic strokes. Many people don't know they have high blood pressure. Some people who do know they have high blood pressure are not that good about remembering to take their medications on a regular basis. They may run out of medications. Some people have limited funds and try to stretch out their medications. Irregular heartbeat, as you heard on the video, called atrial fibrillation, increases your stroke risk 5 times, and that requires anticoagulation. Smoking is also very, very bad. Anyone who smokes should stop smoking and not start. Drinking too much alcohol, they already reviewed that. Cholesterol and diabetes. Diet is a big factor, and I'll review the diet in a minute. Not exercising regularly. Sleep apnea is another risk of stroke, one that's often overlooked. In of itself, it is an independent risk factor for cardiovascular disease, whether or not you have other risks such as high blood pressure or diabetes. being overweight, we want to try and have a normal BMI. I also have BMI sheets in the back. Risk factors that you can't control, family history of a stroke, or if you've already had a stroke or a TIA, and then there are, of course, some rarer causes of stroke. Here's a revelation: women are different to men. This is not going to answer all the guys' questions about women, but there are new guidelines for women. We have unique risk factors, hormonal, especially if you smoke. Also, women tend to, just like with heart disease, tend to have different signs of stroke, and so we may ignore them. Women also, we are caregivers and tend to want to do everything else before we take care of ourselves. Women have a higher lifetime risk of stroke. Essentially, I believe that's because we tend to live longer than men. And women have a poorer recovery than men. Most women, I think, if you ask them, worry about having breast cancer, but more women will die of stroke than breast cancer. Warning signs of stroke, she went through this in the video. The key to this is sudden. So if you experience sudden confusion, sudden dizziness, sudden difficulty speaking, sudden difficulty walking, call 911. We lose 2 million brain cells a minute. And again, depending where your stroke is, you have different symptoms. When my son had his stroke, I thought he had the flu. He had nausea, vomiting, and he was dizzy. Fast we went through, so your challenge is, by the end of the day, I'd like you to tell one other person about FAST. The more people that know this, the better. We want to educate our children, grandchildren, sons, daughters, about how to recognize stroke. Stroke's a medical emergency. It should be treated like a heart attack. If you come in via 911, you'll come in as a stroke alert, and you'll have about 10 people around you. The goal is to get the TPA if you qualify, which will bust up the clot and reduce disability. And Agnes went through that. The goal is to give the TPA within 60 minutes of you arriving in the hospital. We give it within 3 hours of the onset of the symptoms. Sometimes we can stretch that out a little bit in certain people. So knowing when your symptoms started is really important. So on FAST, face, arm, speech, time. Time is call 911. I always tell people that time also means to note that the time the symptoms started. That helps the neurologist and the stroke team determine if you are a candidate to receive TPA or other intervention. And as Agnes said, if you don't qualify for TPA and you have a large stroke, there are other interventions that Dr. Case can do. Window of opportunity, I already told you that. So the American Association calls them the simple sevens. I have a handout back there. They're actually not that simple for a lot of us. I think the most important one is the exercising part for most of us. If that's certainly a challenge when people are raising family, working, or doing other stuff like me. I'll do everything else before. I'll do the laundry and everything before. But sometimes they give patients a prescription to put on the refrigerator, just like taking a medication. This is just like taking your blood pressure pill. You're going to go off and do your 30 minutes of exercise. We have a program at HealthFit, which is on just off Clark Road, and it's called Forward Fitness for Stroke Recovery. It's twice a week. It's a supervised exercise program, and it's excellent in that it's supervised, but they also tell you how to use the equipment. It's only $99 a year. Whatever you do to get moving, we are supposed to take 10,000 steps a day to maintain normal health. So for me, that's probably about 4.5 miles. Anything you do to get moving is great. Park further away from the grocery store, walk around Walmart, walk around Sarasota Mall. We have an area down there. Um, and